are welcome to the Wisconsin Neurodiagnostic Centre. This is our waiting area. This is where we take the clients when they come in so that they feel at home, they don't feel pressured. We welcome them, take their details, their name, demographics before we take them in so that we start the prepping. Because you know, two clients might have the same name. So we take them here so that we take good demographics before we take them in. So this is our waiting area, so I'll take you in. So when you come in here, when you get in here, this is our prep room. This is where we prepare the scalp of the clients before we take them in for testing. So what you see here are technicians prepping a client. What you see on the client's heads are called electrodes. So we place them on the client's head to be able to take what each part of the brain is doing, because each part of the brain is responsible for something. Presumably, the back of the head is responsible for sight. The front of the head is responsible for reasoning. So what you see here, we place the electrodes on the scalp to take what exactly is going on. So we know when we are going to tackle, we are tackling it from here. We are not taking here. So we don't tap into mistake what we are doing. Yeah, so what you see here is a prepping that is currently going on. Electrodes, prepping gel, and then a plaster to secure the electrodes on the scalp of the head.
And then what we do here before we do the sticking of the electrodes, we have a tape measure. We have to measure the circumference of the head. We measure the diameters, and then we divide the head. We use what we call 10-20 system. The 10-20 system means when we measure the circumference, we divide it by 10. So that will help us to get the lobes. And these electrodes are not just placed on any part of the scalp, but it is a measurement. Then we use what we call a nipple. And this one is one of the preparation for the patient to prevent artifacts. They may be gel or ointment or other things on the scalp. But before they come, we prepare them that they should not apply cream or pomade or any other things on their head before they come. That is the next day. Then when they come, we don't actually trust or base on what they have done in the house. We also use what we call a nipple. We place it on wherever we want to place the electrodes to clean it, to make it more sterile. We have what we call 10-20 cream or conductive cream. This one, it is just like pomade. This is how it is. So we use the electrodes to just get some small amount of it to help it to be able to stick into the scalp. And it also helps in the conduction between the brain and then the electrodes. And when we are done with that, to prevent it from removing, we have to place what we call adhesive tape on the electrodes to hold them in place. Then when we are done, we have what we call gauze bandage. It is also like hat. When we are done with this one, we will wear the hat to also help it to then we move the patient gently to the testing or the recording.
Because if you tune in your radio, at times you see you've tuned into Peace FM, but by the time you realize it's catching other frequencies. So that is why we are placing it at a specific place so that we don't happen to get other things we don't need. Because there are a lot of things going on in the brain. So we cut all the interferences before we take the patients to the prepping room, the testing room. This is our changing room for individuality of man to be maintained. We have a changing room where the client comes in alone to change himself into a gown before we take him into the testing area.
Yeah, so here is where we take and we do our EEG recordings. EEG recordings take like roughly 30 minutes for us to finish. So electrodes have been placed in the prep room already. So what we do is we just connect our EEG box to our laptop, and we start a recording. We take the name of the patient, the age, the sex, and the little used to that we will get. So after the 30 minutes program, then we make the patient go back to the changing room and the neurologist will go through and report on what he got.
So these signals you see here are the readings of the things that goes on in the brain. When the client blinks his eye, it will show a reading here. When the client sleeps off, it will show a reading here. So everything going on in the brain, because the brain is made up of electrical discharges. So So everything that goes in there, it shows here for the technician to see. And all this, you get your report within 24 hours. This is the only Neurodiagnostic Centre you can get your report in 24 hours.
Wow.
So we are recommending it to everyone. Yes, the speaker said, mind your mind.
Yeah.
Your mind is very essential.
Yeah.
So please, we welcome everyone to come in here. It's open. You can just walk in. You don't have to wait to be sick before you do it. You can just walk in anytime, any day. Mental health affects us all. So you are all welcome anytime in here to the center. Thank you very much.